If you're just having one binge night eating ice cream and stuff, you're binging, you've got glucose and fat, and you may well dispose of those things fine. It depends on your incoming state. So if you're a relatively healthy person, an insulin sensitive person, a night of binging really isn't going to cause any trouble. Certainly nothing long term, right? What we're really talking about is the chronic result of doing that. And so the glucose piece and the fat piece are slightly different. The glucose piece is very tightly regulated. If you consider the difference between a person who doesn't have type 2 diabetes and someone who does, it's literally only the difference of 1 teaspoon of sugar in the blood. I mean, it's a remarkable difference in terms of how subtle it is. That's how tightly the body wants to regulate glucose. So when the body can't regulate glucose, that becomes type 2 diabetes. Long before that's happened, you've usually started exceeding your storage of fat. And it's that excess fat that spills out of the bathtub that is making the body dysfunction around glucose regulation.
I've recently heard that it's more dangerous to be a lean diabetic than to be an obese diabetic. Do you agree with that?
The data absolutely suggests that that is the case.
Okay, so if I'm a lean diabetic, then what that predicts is that my water balloons are very small, and they just can't take much water, and so they keep spilling back out, spilling back out, spilling back out. So if I'm a lean diabetic, I probably have a ton of fat around my viscera.
Yep. And that doesn't translate to much weight on the scale because you don't need much of that visceral fat, peripancreatic fat, intrahepatic fat. You don't need much of it in total mass to cause absolute metabolic destruction.
Okay.
And so that's why the lean, insulin resistant, the lean person who's metabolically unhealthy has the worst outcome.